Hi, I'm Dr. Brad Trivax here at Island Fertility, Division of Stony Brook Community Medicine. Today we're going to talk about something that affects 8 to 10% of all women who are reproductive age, and that's polycystic ovary syndrome. PCOS, or PCOS, as some people may call it, are driven by hormones. Hormones in the body are a necessary evil. They are the body's chemical messaging system, and they let our bodies function correctly. But what happens when the body starts acting up and your hormones are not working properly, things can get out of whack very quickly, and there's different symptoms and issues that can affect a patient that should bring you into the doctor, because this is very treatable. First and foremost, patients with polycystic ovary syndrome oftentimes have elevated androgen levels. And androgen are male hormones associated like testosterone and other derivatives of testosterone, which lead to symptoms that most women are not so happy with. For instance, unwanted hair growth, hair on the face, hair on the body, excessive hair growth known as hirsutism, adult acne that you just can't seem to shake. A lot of times this is also androgen driven. Sometimes women will get male pattern baldness, and this is different than the normal shedding of hair that is cyclical, but you truly get a male pattern baldness or shedding of scalp hair. Another area that patients will come in is that their cycles or their menstrual cycles are very irregular, or they're completely absent. And this can lead to problems for patients who are trying to conceive, because they have no idea when their period is, they have no idea if and when they're ovulating, and they cannot time things, and it becomes very frustrating for them. Again, this is treatable, as are treating elevated androgen levels. Another side effect of polycystic ovary syndrome can be an imbalance in a patient's insulin and glucose levels. When you have that hyperinsulinemia or excessive insulin in the blood, this can lead to a situation where you have insulin resistance, you can become pre-diabetic, or develop type 2 diabetes. And finally, weight gain. And women will come in complaining of weight gain over the last year, more so than normal. They're eating less, they're dieting, they're exercising, and they're still gaining weight. Very, very frustrating. So we want to start, sure, with the appropriate lifestyle changes of diet and exercise. More importantly, we want to make sure with fasting blood work that your insulin and glucose levels are balanced, and that your hemoglobin A1C is in appropriate range. If not, there's medication to treat it to help you balance out those levels, and then actually have a chance to lose the weight that you're trying to lose and stop gaining weight. So if you feel like any of these symptoms sound like it might be something that you or someone you know is suffering from, have them see their doctor, see their gynecologist, or see a reproductive endocrinologist and get the treatment now.